Lengthy public hearing today looking into the mental health crisis. It lasted from 11 this morning until 2 o'clock this afternoon here in the Queen City, and you can see on hand the State Attorney General who sponsored it. Among the dozens of speakers, you had lawmakers, doctors, family members who are dealing with mental health issues, and Channel 2's Claudine Ewing was there.
The State Attorney General set the tone from the start. This hearing isn't just to listen and do nothing, but to examine a system. Families bared their souls, some who experienced loss as a result of relatives dying by suicide, only to review medical records that indicated red flags.
But his statement in that was that he was going to kill himself and that he knew why. But he was deemed a low risk in the facility, but a high risk to return to their facility.
We're talking about human beings here, people who are in their darkest hour and struggling more than they ever have before. And to think that just people are getting turned away or being told, oh, there's nothing we can do, I can't even wrap my head around it.
There is a clear call for more services. Many turn to places like ECMC. We heard from the person who oversees CPEP.
Our CPEP program should not serve as the sole focus or independently bear the onus of responsibility for our larger system.
And there was a question from AG James.
What do you say to the witnesses who said that ECMC does not provide MICA services for individuals who are struggling with alcoholism, drug addiction, and mental illness?
Inasmuch as the community looks to CPEP in particular and ECMC as, kind of a leader or at the center of the conversation of what can we do to fix the community, but that's a challenge in and of itself.
We're all here today because we share a common belief that the resources and care for those struggling with mental health issues is not even close to being at the standard of where it needs to be.
Access versus connectivity, and do not think that they are both the same. Access is build a building and they will come. But if the people don't feel connected when they go into that building, then what is the point? You have a beautiful lobby.
All right, Claudine joins us here now. A lot of complaints today, Claudine, during this hours-long meeting about the treatment at ECMC and some of the services that are being provided there, or I guess services not being provided there.
Yeah, and what we heard from the families who have actually had people there, it's pretty simple. They've taken their relatives to ECMC. They got some of the services that they needed, but then some of those people were released from the hospital. And in some cases, they didn't make it back home ever. And so part of the problem is, are there enough beds? Are there enough workers to help the people who are coming in there for services? And that is really a nagging problem for people in the community. It's a problem for lawmakers because today, Michael, we actually heard from lawmakers saying, hey, we need help. We need something to be done. And that's why the New York State Attorney General is holding this hearing. It wasn't just here in Western New York. She's holding it across the state because when it comes to mental health services, it's a problem. They need more access to services.
And Claudine, did you get a sense as you're watching this and following it along today that this issue with ECMC, which is, it is our region's public hospital, right? And it's where a lot of these cases end up. Did you get a sense from the Attorney General's office that number one, they sort of understand the issue and that they have the ability to do something about it?
I think the Attorney General was asking that question specifically to ECMC because basically she's saying, we're hearing from the people, they just heard from the people, so what are you going to do about it? And I think as a result of this hearing, we're going to see either some changes or money has to be coming into the system in order for changes to be made so that they can get more people, so that they can get more beds. So people are talking about going to ECMC, going to Bryland, there are only so many beds, but yet the problem is so massive right now.
All right, Claudine Ewing following this story for us today. Claudine, thank you so much.